Hello and welcome to Bringing Education Home. I'm Herb.
And I'm Christina. And together we bring you experts and ideas to help grow healthy, happy, successful families that are both inside
and outside the box. If you like the show, be sure to follow Christina on Facebook.
And please leave us a like review on your favorite podcast platform.
Today, I have the pleasure of introducing Dr. Ynge Ljung. She is an acupuncturist physician, a naturopath with 30 years of experience, a certified body code practitioner, and author of Finding Your Lost Child. She also created the Allergy Kit, a simple do-it-yourself family allergy solution. Her diverse background includes chemical engineering, artisan work, and raising a family internationally. Dr. Ljung's lifelong passion for health and nutrition fuels her commitment to holistic healing and utilizing cutting-edge modalities. Her passion is to help families with neurodiversity naturally, without drugs, and with a healthy nutrition and allergy elimination as a healthy solution. Welcome, Dr. Ynge. It is a pleasure to have you here. Thank you very much for joining us today.
Thank you much. Thank you very much for inviting me.
Well, start out for us a little bit more in your past. Why did this become a passion for you? Why was this something, or what was that turning point that really made it like, you know what, I really have to do something about this?
Well, it was in the beginning when 30 years ago, when I graduated, I just treated people in general. And then one or another didn't have the result that we both wanted. They came back with the same problem. And I looked into what could be the missing link and spent a lot of money and a lot of time to travel to different learning things, and found that allergies can have a big impact on our health. So I started to treat people for allergies. And then one day I got the kid with autism. I didn't even know what autism was. This is because this is now 25, 28 years ago or something.
Yeah.
And this child was very wild, very untamable, so to speak. He would run around and scream and make a lot of noise. And I wasn't even used to that because I didn't have really kids in my office. And to make him quiet, the mother pulled up, I don't know, 2.5 feet long red gummy snake. I said, so she gave this to the kid to eat. And of course, he was quiet for the 10 or 15 minutes it took for him to swallow that. And then he was worse. So he was so bad, so the mother had to go home. And I started to treat him. And at that time, I used another technique. I didn't have my own allergy kit at that time. So after like 4 or 5 treatments, he started to speak better. He started to make sentences. He pronounced things better. And by the way, he was in a school, in Marino School for autistic children, for speech therapy. And he also had all these temper tantrums, minimum 7 temper tantrums a day, and the clothes he didn't want, and picky eating and all that stuff. So of course he had to change. I didn't even really know how much food affected them, but by treating the allergies that they didn't think they had, that's how he calmed down, and he started to eat better. And for example, that he didn't want to have certain clothes was an allergy to fabric. So, and I think that is not uncommon, because these kids, they are so sensitive, and they just are allergic to so many things. And after that, I had more kids, more on the spectrum. And I saw what the parents go through. I saw how often marriages break. And mostly the mother, even though sometimes it's the father, but one of them stays with the kid, and they don't have a life. They can't sleep because yeah, you know all about what the reactions with what they can have.
Yeah.
And it's not easy. It's very, very hard. And that made me really passionate about helping them, because just by changing food, just by being aware of certain foods that really, really affect them, because many people, they don't put it together. They don't put together that they give them a gummy snake and then they run off the walls. And the same with food. And of course, if they're allergic to, because they are allergic to almost everything, whatever they give them, they react.
Yeah.
So it's very hard for them, if they don't have any knowledge about nutrition, that food is what is affecting them. And it's the food that makes them react like they do. So that was how it started. And that's how I became passionate about these families.
Yeah, we talk about being inside and outside of the box, and so many of the things you just said like ticked my outside of the box stuff. So like we've talked to a lot of nutritionists, and nutrition in the United States is really, really poor. And a lot of that is due to the food pyramid. And
oh yes,
come to find out that the food pyramid wasn't produced by doctors. It was produced by advertising companies to try and sell more grains and cereals and stuff. And so
well, yeah.
So what people have been taught for like the last 20 or 30 years as the way to eat healthy, the more healthy they try and eat by going by the food pyramid, the more
Yes,
sick they
the worse
get.
they get. Yeah,
And
no, it really started with when the tobacco industry, they went down, right? Because that was not popular anymore. And they had all these lobbyists, and they had all these scientists, and they had all the money. So they went and they bought up a lot of the food companies. And then they had their scientists figure out what makes the food tasty, what makes it habit forming. And I mean, I don't think it was meant to kill them, but the other thing is also that the sick child is worth much more than a healthy child.
Exactly. The impact is so much more. Yeah. Exactly.
And you know, when I was a kid, there were movies about autistic children because there weren't very many of them. And so they would like make movies about, hey, this is what this autistic child was like and what the parents go through. Now, because it was like 1 in 1,000 kids were autistic. Now it's like 1 in 20 or even worse than that in some places.
Yeah.
And so it's like you don't have to watch movies. You just have to like check out your neighborhood and you'll find some autistic children. So you know, there's so much of that has to do with nutrition. So much of that has to do with other factors as well.
Allergies and inflammation, like she was talking about.
Yeah, and I mean, it even allergies is a symptom.
Yes.
It comes from what we eat. And I think, of course, also vaccinations has a lot to do, because vaccinations do not build up your immune system as they used to say. It takes it down. And I think because there are more and more generations now who have been vaccinated, I mean, we can see on people, they are getting sicker and sicker. And of course, food doesn't have any nutrition if you buy the processed food.
Right.
At all. And it's just a downhill slope. So I think that has to do also that every child now is getting weaker and weaker, every generation. It's not like before. They also say now that the child will not reach the age of their parents. This is the first generation that they will not become as old as their parents.
Yeah, you went into another huge one there with vaccines, because you know I've recently been watching some people who are very well informed on this, and there aren't any studies that show that vaccines don't cause autism. And because there are no studies, the experts in vaccinology say there is no studies that show that it is causing it, so therefore it doesn't cause it, because the studies haven't been done. So there's no causation or correlation because the studies have never been done. So their default position is because there's no studies, it doesn't cause it. And they were ordered 30 years ago to actually do the studies, and they don't do the studies because the one study that they did showed that there was a correlation between DTaP and autism. So they cut out all studies so that they could say that vaccines
Yes.
don't cause it.
I hope that will change now.
Yes, hopefully.
I
it will
hope that
too.
changes too.
Exactly.
And the funny thing that you talked about is the red gummy snake, because you got so many people with autism are finding out that the red dyes cause spikes in bad behaviors. And then you tack on top of that, that's
sugar.
mostly sugar. So you're giving them sugar and an agent
And a toxic.
and it's toxic. So it's like, yeah, that's like you want them to calm down, and then you shoot them off into space.
Yes.
So that dye number 3 is now, I think since last week or something, now that is prohibited. They can't use it anymore.
Yeah, that just
but it has been prohibited in Europe for 25 years or 30 years.
Yeah, there's like 180 some foods and substances that are banned across the world, but are still allowed in the United States.
Yeah, because here, nothing is bad until it is proven that it is bad.
Right.
In other countries, you have to prove it's not bad until they give it.
Yeah, and hopefully that's changing. We really hope that that's changing with what's happening right now. So
yeah, and the rest is to try to teach people that fast and processed food is not food.
Correct.
And another big one right there is in your allergy testing. So many people have what's called leaky gut syndrome from eating ultra processed flours. So the white flours, and it goes in and it opens up the holes in the stomach. And then instead of the food digesting and the digested particles there are undigested particles that are getting into the bloodstream. And if that happens and you do an allergy test, it'll show that you're allergic to that food because it's in your blood system. And you might not actually be allergic to it. It might just be because you have a leaky gut syndrome and it's showing an allergy. Because she went through that herself.
They produce antibodies and that reacts. But I mean, I had one patient or client, because I didn't see her personally through my allergy kit, who could only eat red meat. She was allergic, had reactions to absolutely everything else. And probably because it's a protein in wheat that turns into zonulin that makes the holes in the intestines or in the intestine lining. And then we have the other thing, and that is the vagus nerve, not Las Vegas, the vagus nerve that goes from the brain to the gut. So if there is an inflamed gut, the brain is also inflamed.
Yeah.
So these poor kids, because they crave all this inflamed food, like inflame producing foods like sugar and wheat, just to take a couple.
Exactly.
So it's no wonder.
Yeah. And one thing I would just want to say here, because we all have done a lot of research. You are a doctor, Herb and I are not, but we've just learned so much over all of these shows and everything that all we're doing is saying, parents, please pay attention, right? There's a lot of information out there that people believe that may not be true. And for you to do your own research, talk to your doctor, but then also follow your own gut instinct as a mom. If you know there's something off, check into it, right? So, this is a huge discussion, and it's something that we want parents to be empowered about, to really think about and make really great choices for you and your family.
And we've also done a lot of research on our own, because I have brain damage. And so I had to learn how to feed my brain and to work with that. Christina had a problem with her ears where she lost her balance.
Vertigo.
And she went through a lot of allergy testing. And it was really interesting because everything she was allergic to was everything that we were eating on a regular basis. And so so that's how we found more out about the leaky gut, because when we found out about that and we cut some of that leaky gut stuff out and fixed that, then we went back and retested her allergies, and she wasn't allergic to the stuff that they said she was. She was just allergic to the stuff that she was eating regularly because it was getting into her bloodstream and creating the antibodies. So it's really, so we have learned so much over the process of just trying to become healthy ourselves.
Yes, and I also, hooking up to what you said, so this is not this is not medical advice, what I'm talking about. It's you have to go to your health practitioners and not say goodbye to them, and make, as you say, make your
Yes.
own research yourself and find out what. And every child and every person is different, and so it's so wide.
Exactly. Yeah. And some of the families that we work with, one family in particular, the mom has done a lot of research, and it's amazing what she's even telling me that the newer stuff is that she's finding out about different nutritional supplements that are really good for her autistic child and that help him sleep better and things like that. So the information is out there if you're willing to go after it. Exactly.
Yeah. And she's watched a lot of our episodes on this, and she's like, wow, that you get so much help here. It's like, this episode is like, you said this and I tried that with my kid and wow, it worked great. And this episode you said this and I tried that with my kid and wow, that worked. So, you know, we are bringing people in who really know what they're talking about. And so listen, because Dr. Ynge has a lot of great information here. So pay attention to what we're saying, because if you're having issues, there's a lot of help here that was going to be able to be shown, and if you just pay attention.
Yeah, and I mean, health in general in this country is, I mean, 80% now, they say, are pre-diabetic or diabetic.
Yeah.
And my belief is that is the beginning of the downhill road to, first of all, diabetes, of course, heart attacks and strokes, and people are feeling sick, but I don't know. They're so used to it. They have been eating this food and don't understand, because they're so used to it, that they are sick. And if you take the people who are pre-diabetic or diabetic, 3 out of 4 people don't even know that they have it.
Right.
So all of a sudden they have a stroke. Who wants to have a stroke at 60?
Why?
Yeah, and so much of that can be actually right now tracked back to sugar as well.
Oh, absolutely. That's what I mean. A lot of things come from sugar.
Right. Because, sugar wasn't introduced as a staple until like 50, 60 years ago. So we're not used to that. So the refined sugar is one of the most addictive substances on the planet.
Not only that it is refined, it's also GMO food.
Yeah.
Yeah.
Exactly. And I think I came here to this country in 1990 in December, so say 91. And shortly or around that time, that's when they started to come out with fat-free food. And since then, we have all these people with sugar addiction. They're sugarholics.
Yeah, exactly.
And diabetes. And I mean, I had a friend, I would say she was obese to start with. And she then, with that fat-free, now I can eat this and I can eat this and I won't get fat.
Yeah.
And I gobble down all my fats and butter and whatever it is.
Right, exactly. All the healthy fats. And that's what finally they're probably getting around to that. Oh, wait, some fats are okay as long as they're the healthy fats, right?
Because she was always jealous at me. She's or envious. She kind of, I can't believe you are so skinny, because they call you skinny if you're thin.
Right. Exactly. Do us a favor and jump into a tip or two that might help parents through some of this, or to even get started, because a lot of parents are like, oh my gosh, having to change my whole diet or having to change so many things at one time is like so overwhelming. Can you give them a tip or two just to help them maybe even get just started?
Yeah, especially with like picky eaters, because kids like sweet stuff, and it's like, oh, if I can't get my kid to eat, I give him something sweet, he will eat. How do we start getting our kids off of the sweets and into healthier foods?
It is very hard. I mean, I have my allergy kit, of course, that I recommend. I have one specifically for autism also. And the second treatment is for sugar and vitamin B. And often they have to treat it several times. But once it so-called sticks, then they don't have that craving anymore. Because I think also with the sugar addiction, they also have candida. Right. And the candida per se is the bacteria we need we need, but not when it's overgrown, then it's not good. And they're sitting down there, we need more sugar, and they are horrible, horrible sugar cravings.
Yeah.
And what I recommend is for the sugar craving, put 1 drop of stevia on the tongue.
Yeah.
Because it's so sweet.
Uh-huh.
And that kind of cuts it, at least for the time. And it's nothing dangerous.
Oh, okay.
So that's something you can.
Cool.
So I find stevia to be very, very bitter. So
Yeah.
there is a sweetness to it, but for me, it's really bitter. I've
Well, it
actually kind of
depends.
switched to monk fruit sweetener
Well,
which has
that's-
xylitol. How do you feel about monk fruit sweetener and xylitol?
Well, I think in monk fruit, probably people can take more. Xylitol is a little some people have a reaction to that.
It's really bad for
and then-
dogs. So if you are using it, make sure you don't let your dogs
No.
have it.
Yeah, so I don't know if it's that good for people either.
Right.
Well, we are probably different digestive systems, but still.
Well, the
And-
reason I said I added xylitol is because most monk fruit sweetener is actually cut with xylitol. So it's really difficult to find monk fruit
Yeah.
sweetener
It is
that
true.
doesn't
But I
have
was
that.
thinking more about xylitol by itself. But I use a stevia. Of course, it is processed, but I don't like the real stevia either because of the aftertaste. But I use something called Cal, Kal, and it really doesn't have any aftertaste.
Okay.
And I think it's better to use the processed stevia than to use sugar.
Yeah.
It is, for example, and you said you had a brain injury. I had, it's now 5 years ago, I had sinus operation. They were in all over. It lasted for 6 hours. So if that is not a brain injury, I don't know. And since then, I have a problem with my blood sugar because of the vagus nerve. So everybody who has a brain injury also has a gut problem. It is just automatic.
Uh-huh.
Yeah,
And
because your brain creates a lot of the chemicals and a lot of the signals that actually regulate your body. So a lot of
Well, and
people with
also-
brain injuries do have a lot of issues with their stomachs.
Yeah.
Yes, and not only that, the feel good. I mean, here the depression comes in and the mood swings, that the serotonin, I think they say that almost 100% of serotonin and 50% of the dopamine is produced in the gut.
Mm.
And then that is supposed to be carried up with certain bacteria. And when the bacteria is not there, it cannot come up to the brain. So it's not produced in the brain. So when you go to the shrink because you're depressed, they're looking at the wrong place.
Oh, wow.
But I heard now that there were, I don't know if it's a school or something, but I heard there were a couple of people, psychiatrists, who go through nutrition program.
Good.
Because that's where they have to start, not giving them these pills,
Mm-hmm.
happy pills that, by the way, it's not absorbed totally by the body. They pee it out, and then it goes out in the water streams. And now the fish, they don't know if they're girls or boys. Have we heard that somewhere too, perhaps?
Uh-huh.
I just wonder how much of that links to people too.
Yeah, and if antidepressants worked, we wouldn't have the most people on antidepressants in the history of the United States right now. So
Mhm.
it's not necessarily working, it's just masking the problems. So if you want to get off of antidepressants, you really need to do a more natural approach. So nutrition. And again, I'm going to say most doctors right now, especially the allopathic medicines, the schools they're coming from, they teach us, look, you have this problem, you take this pill. Have this problem, you take this pill. And so I really like that you have a naturopath in your name, because they might be a little more expensive, they might take a little more time, but they go into you and they look at what works for you, and they help you get your nutrition set back up. They help you get your hormones set back up through natural processes. And so I stopped going to, if I break my arm, I'll go to an allopath.
Yeah.
If I'm looking to be healthy, I go to a naturopath.
Yeah, no, we have to, everything starts with nutrition. I mean, Hippocrates said that over 2,500 years ago. Everything starts in the gut. And it means that people have to start to cook. there are hundreds of different, I think there are so many programs on TV that they can go and learn how to cook. Maybe that's not the best program, I mean, when it comes to nutrition, but I'm sure you can find pretty good programs.
Yeah.
And do something simple from the beginning. I recommend to get an air fryer because you can make a dinner or a lunch like in half an hour, within half an hour.
Yeah.
It takes more time to go and pick something up.
Yeah.
And then make something nutritious.
Cool. Yeah. And that's something that, we, as when we're talking with families, is that, families are like on the go all the time. They have their kids in so many different activities, and they're in so many different activities and things like that, that they think they don't have time to cook, right? But we keep coming back to what's more important, happy, healthy children, or being on the go all the time. And being on the go all the time, is that really helping you be happy and healthy? Is it helping your child be successful when they're stressed out about all the different activities and everything like that? So we really focus on asking parents to take a step back and think, are you doing it just for busy sake, or is it something your child really, really enjoys doing? Make sure you're making those good decisions.
I think you're absolutely right. And I think kids today, they are so stressed out.
Yeah.
And parents, of course, they have to go back and forth and pick them up and stuff. And I think you're right. They should take that time. They could take a Sunday or whatever day and go shopping, make a list what they want to do, and incorporate their children, have them help to cook.
Yeah.
And kids like that. Most kids do.
Yeah.
Yeah. So we also talk a lot about family values, and the people that we work with. Family values are some of the things that we start off with. And so many people's like, well, I'm doing this for my children. We want, our family is the most important thing. Well, if your family is the most important thing, but you're eating lots of sugar, you're eating out all the time, you're not spending time around the dining room table, you're not spending time in the kitchen preparing your food together. It's like, that is some of the most healthy activities that you can do as a family for the present, for the future, and for just the health of the family dynamics all around. And so it's like, but we don't have time for the family because we have so much time we're trying to do with the family. So that's one of those weird conundrums that's out there. It's like, if family really is all that important, and it's like, oh, I'm doing all of this for my family, then it starts in the kitchen.
Absolutely. Absolutely. And another thing is breakfasts.
Yes.
How many parents give them orange juice, first of all, and they believe it's good for them. But first of all, it's mainly water with additives, and vitamin C, when you open the bottle, that disappears anyway. And the sugar goes out in the bloodstream immediately.
Yep.
Then often they get something with bread, or maybe sweet, maybe whatever. So when they arrive to school, then their sugar rush is just up and going down, and they get what do you call it? It falls down. What is that called? You know what
the
I
trough.
mean? Yes. And that means that like the first hour in school or the first 2 hours, they don't learn anything.
Now a few words about vibrant family education.
How many entrepreneurs and business owners start out on this journey to make a better life for their family, only to find that it took so much more time and effort than they were expecting that they had even less time for their family? I know I did.
At Vibrant Family Education, we want to help you reach your family goals while you're still building towards your business goals. We do this by bringing you the third leg of the stool to keep your family upright, family education development.
By bringing your children's education home, you will be able to model your work ethic and family values as you overcome obstacles and challenges to build your business. Instead of learning facts to pass tests, your children can be watching and seeing the dedication it takes to build your business and the legacy you want to create for their future. They will be able to witness the struggles and joys, the wins and the losses, and learn from you how to persevere and grow in life.
Instead of waiting until you get successful to spend more time with your family, start with the end goal in mind and bring your family home. Instead of trying to repair your family after you reach success, let us help you start achieving your family goals from the outset. Learn to be successful with your family now, and no matter what happens in the future, they will be better prepared for life. especially after watching how you cared for and built not only a business, but a healthy, happy, and successful family.
We offer a wide range of educational services, including how to easily get started with homeschooling. Come visit us at vibrantfamilyeducation.com and let us show you how. And now, back to our guest.
They can't concentrate, they can't focus.
Yeah.
And then they go to lunch and the food in the cafeterias is so full of sugar and preservatives that they spike again, and they don't have enough time to play and work some of that out. And then you force them to sit back down and be quiet again. And then if they have trouble sitting down, they get sent to the doctors and put on medications to calm them down. But again, you're shooting them off with sugar and then trying to bring other substances in to calm them down. Whereas if you just got their blood sugar consistent with the proper diet, then so many issues and behavioral issues go away as well.
Yeah. No, and I think sometimes the teachers should be put on calming medication so they could, because I mean, kids have to move. You can't expect them to sit still. And specifically, I saw that with my grandkids when they were growing up, that no breaks. The 5-minute break they had was from go to one classroom to another. When I grew up, of course, that's a long time ago. We had one classroom for one class. You stayed in the classroom and you had your books there. And if there were other teachers, teachers came to your class.
I love that model.
Part of what we do with Vibrant Family Education as well is we help parents take their children out of school, and we help them learn how to homeschool, give them confidence, pad it, make it easier for them so that they can have that edge, so that they can teach their children how to learn instead of the facts and the stuff, and to sit down in rows and to lose their individuality, and every time they wiggle get in trouble. Like, no, take them home, let them wiggle, let them run, and then teach them how to learn when they're in a good space for it. And so that's kind of what we do.
Yeah, instead of shutting them up with a phone.
Right.
Exactly, that too. Yeah, exactly.
So, no, I know I have one of my next youngest grandson. He is now studying in Holland. He went to university here in South Florida. And now he is in Holland, and he started there. He's finishing up. So that was 3 years ago. He said, I finally learned something in school.
Yay, I'm so glad. Too bad you had to go to another country to
exactly. That is pretty scary.
Yeah, exactly.
So tell us a little bit about your book, Finding Your Lost Child. What is that about?
Okay, so it is really more, what should I say, ideas about, of course, I talk about food and how to shop. You don't go in and shop in the center of the store.
Yes.
Shop on the edges.
All these things. And what do I have more? I can look at, I forgot. look at the ingredients is about the disorders and allergies and where to start, and diet and nutrition, of course, and lifestyle. And that's another thing when people go through the allergy kit, when I always recommend that the parents go through. We all have allergies, and how much healthier the whole family gets. And parents often they have autoimmune diseases and they go away as long as they keep doing it. And then there's also about clearing the body from toxins. So it's, I had my nephew's fiance is a singer. She won the European thing twice last year. So she's out and traveling a lot. She read the book. I brought the book when I was visiting. I think she was the only one who read it. And she said, that book saved my life.
Wow.
So because she had a lot of things that she didn't, who puts certain emotions together with food?
Right.
You don't.
Especially because sometimes what you eat takes 3 days for the effects to actually hit. So it's like you could eat something yesterday that's going to affect you tomorrow or the next day, because it's not an immediate reaction. It takes a little while to get through.
That's not the allergies, that's the sensitivities. They take time. So that's why what I recommend is that you do a food diary. Write down everything. Write down in the morning how you feel, how you slept, and then nowadays there are even apps that you can just speak in what you do. And then, because that's the only way that where you can get a picture of what did I eat, especially with sensitivities, that it takes 2 or 3 days before you get the reaction. But if you see that reaction and just go back 3 days and do that a few times, you say, oh, I had that. You know that is a problem. So there are a lot of things to do.
Yeah. And that's
but it takes effort.
Yeah, it does take effort. And it takes a little bit of a puzzle, a problem-solving brain, because my mom was the same way. Whenever we would go to a certain restaurant, if she only ate the food, she was fine. And then other times, if she only drank wine, she was fine. But then every once in a while, we would have something there at the restaurant and she would go home and she would get sick. And it took us for a really, really long time to figure out that there was a certain spice on the salad that when mixed with the wine caused her to get sick. But it took several months to try to figure out what in the world was going on, because she was fine most of the time. It was just once in a while that she would get sick later. And it was like a major migraine headache, right? Kind of thing that would come on later. So it's not like she was throwing up like food poisoning. It was like, oh, major headache. So
yeah, no, I look at myself, because when I do everything with my patients that I do for, for myself, what I do with my patients. And I had fibromyalgia, pretty bad, and nothing had helped. A chiropractic, acupuncture, massage, herbs, whatever. No allopathic medicine for me. And nothing helped until I started to eliminate allergies. And I did not think I had allergies. Then when I look back, I had ear infections as a child. That is a symptom of a milk allergy. That creates allergies. And then you get, today, then it was penicillin, but today they get antibiotics.
Right.
And then when I got a little older, I got headaches and migraines. And I would often have migraine on a Monday. So I thought it was because I had wine on Sunday. I thought it was the wine. But I later figured out we had barbecue. It was the meat and the potato together.
Oh, okay. Yeah.
So, but it took me many years to figure that out.
Yeah, exactly.
But there are all these little things that we don't think about. For example, we take children with, they wake up with asthma or respiratory problems. That is mostly an allergy to dust mites.
Oh, okay. Yep.
And the same thing there, they get antibiotics.
Yeah.
Most of the time.
Or steroids for the asthma.
Yeah. And yes. And with the ear infections, the tubes and all that stuff. I had one little girl who did not thrive, and that she had ear infections, and then she got antibiotica. 2 or 3 weeks later, she got the strep throat, and then antibiotics, and that went on a whole year.
Yeah.
So she was 3 years old, but she was, very, very tiny. Yeah. I treated her for milk, and it was like Santo Remedio. It just totally went away, and she didn't suffer from that anymore.
Oh my gosh.
Yeah,
Wow.
it's amazing how much effort people will go through and how much pain and money that they'll spend just so that they don't have to change their diet.
Yeah.
Whereas if you start working on your diet and change your diet, then so many of the other issues that are affecting your life can clear up. So behavioral issues, health issues, sleep issues. So diet, one of the things that I really like is if you don't eat your medicine, or if you don't eat your food like it's medicine. So eat your food like it's the medicine for your life. Then eventually you'll be eating your medicine like it's food. So if you don't treat your food like it's the life-giving essence of yourself, then you'll end up taking medicines for the rest of your life to try and compensate for not eating healthy.
Yes. And when we look at that 1 child out of 2 That means 50% of our children today, have at least one chronic illness.
Yeah. Oh my gosh.
And that could be, if they don't change what they eat, I don't know where the country is going.
Yeah, exactly.
Well,
oh my gosh.
I'm going to kind of put myself here, but we've got a lot of people right now that are looking at that and are changing that. And it's like, they understand that there is health epidemics, that we're the most unhealthy country in the world, even though we have like the best doctors in the world. So why is that? And so now we have people who are saying, it's like, our kids are sick. So right now they're like going through the Department of Health and getting rid of that. It's like, because if the Department of Health was working, then we wouldn't have the most unhealthy country. So
exactly.
So we got some hope on the horizon, even just for the education, to wake people up and to get them looking for themselves.
Yeah, that's my goal, is to wake people up. And I mean, if we talk about reactions, look at wheat. Wheat is another one.
Yeah.
Yeah, I miss my bread. I miss my bread a lot.
Yeah.
But I know a lot of people who are allergic to wheat or gluten, and then they go to Europe and they don't have any problems. So in the United States, a lot of times it's the stuff that's on the wheat, like the glutamate and
it's not only that, it's also the chemicals they put in that they can't have, that they put in the dough so the dough can stretch more, I guess, for pizza and stuff, that they can't have in Europe. It's the same with me. When I go to Europe, I can't eat all breads. And it's not that I'm not gluten intolerant, I'm wheat. I have an allergy to wheat, even though I've treated myself many times. And it started with that I could not sleep on my sides because my hips hurt so much. And when I asked the chiropractor, he said, "Oh, you're getting old." And I said, "How come it hurts sometimes and not other times?"
Right.
And then we were very busy a week, and we went 3 times to the same restaurant down the street, an Italian Salvatorian restaurant, where they serve bread that they cut. It's newly baked. They cut it in thin slices and flatten it out, and then with this chimichurri on top. And the 3rd time we came in, I had been okay. The 3rd time I had that bread, I was fine when I came in and sat down. I could hardly get up from the table. And that's when I realized that I was allergic to wheat.
There it was, yeah.
And not the gluten. They can talk about gluten as much as they want, but that's not the whole story.
Yeah, exactly. Oh my gosh. Dr. Ynge, this has been such a great conversation, and you've been giving us so many tips and good ideas for our families. Thank you so very, very much. Would you make sure that our families know how to get a hold of you? If you have said something, if you have sparked their imagination and their curiosity, we want them to be able to get a hold of you and ask you questions and find out more about what you do.
Okay, they can go to theallergykit.com. And there is a place where they can make an appointment, a 15-minute free consultation. And if they want more, they can do that too after they do the first 15 minutes. And I also have another website, which is drynge.com, drynge.com, with a couple of other things that I also do. So,
excellent.
And
thank you.
Yeah.
And those will, of course, be down in the show notes. So you can just, look at her name on the screen or jump down the show notes and click on the link there. So thank you so very, very much. Is there anything that we haven't mentioned that you really wanted to talk about today?
Well, I just want to tell people, please eat organic, cook, and eliminate your allergies, because it will help so much for the whole family.
Miracles.
Yep, exactly.
Yes.
Thank you so much for being here today.
Thank you for being here. It has been a pleasure talking with you today. Thank you for putting yourself out there, because, a lot of times when people do this, it's like the industries and other people's like, no, you're wrong. That can't be right. But you actually are persevering. You're out here and you're sharing your wisdom with people, and you're trying to make a difference. And so that makes you a hero. So thank you for coming on our show today. Thank you for putting yourself out there and for trying to help the world and make it a better place. We need more people like you. So thank you for coming on our show today.
Thank you.
All right, audience, we are wrapping up for today. And as always, please make sure that you follow our guests, and please make sure that you click a like, a subscribe, a love for our show as well. We need to get the word out there to so many families who can be helped with this podcast and with these ideas that we share. So please make sure that you follow it along and also share. Make sure you share with other families. Until next time, take care of you and your family, and make sure you're working towards that happy, healthy, and successful child. Bye for now.
Bye for now. Hello and welcome to Bringing Education Home. I'm Herb.
And I'm Christina. And together we bring you experts